criteria for our trial started out very, very narrow. And it slowly got wider, but they were just having trouble finding kids that fit the criteria. And the first mom in the trial had blogged, and so people were following that. But when my son got in the trial, we said, there's just not enough. There's not enough kids. We want to get, our goal was to get this trial done so we could get this drug to market. And so a friend and I actually made a list. We said, okay, these are all the people we know, and these are their kids, and these are the kids that we think would fit the criteria. So we actually started, emailing them and Facebook messaging them and calling them and saying, hey, have you considered, enrolling your child in the clinical trial? And we said, if the pharma company can't do this, and the doctor and the principal investigator, and I'm not sure what the rules are, either can't do it or didn't have time to do it, we said, well, we're going to take this on. We were very upfront about, obviously you have to read everything. We're not the doctor, but we just felt that they needed a little help to get kids in, and because the criteria was so narrow. Now later the criteria widened, and more kids were able to get in that way too. So, but yeah, it's a tough thing. I think really connecting with the community, and I say sometimes compassion and understanding goes a lot further than dollars a lot of times. So pharma companies and organizations that read the blogs and really connect on a personal level with families, and they feel like you're not just trying to sell them something, but you're trying to really understand. That's what makes that connection. Then that person can become your ally in trying to further awareness and treatment, clinical trials.